To have a mic on? Is this one too loud? Too loud?
Well, this is, I'm not a fan of assessing anything. They already pay taxes. They still get reassessed because you do work. Assessors got it.
I wasn't in favor of it.
Have you ever watched the game?
Oh,
yeah.
Mom's here, she has a cheese.
Games don't usually turn out to.
Hey,
It's not a good
you're
show.
not-
It's not a good show.
No, they went to like, four
Games.
Yeah, couple hands.
Yay, it's working.
Okay, good morning, everyone. Don't forget to silence or at least attenuate the volume on your gadgets. Any papers go to Mr. Curran. We'll begin as we do with a roll call, Madam Clerk.
Bell. Curran.
Here.
Freeling. Present. Harrison. Hinkleman.
Here.
Ott.
Present.
Pittsford.
Present.
Tyler. Here. Bullrath.
Here.
Oh, hi. Werfel.
Here.
Yarborough.
Present.
Elliott.
Here,
You have 11.
thank you. Ray is here now. Does that make 12 or 11? Okay. Oh, Bob, that's right. That's right. Yeah, poor Bob. Okay, minutes from a week ago,
Mr. Chair, I'd make a motion to approve the minutes.
moved by Freeling. Is there support? Supported by Volrath. Anything about the minutes that's a problem, or you're good with them? If you're good with them, all in favor, say aye.
Aye.
Opposed, same sign. Minutes are approved. Requisition review.
Sorry, good morning. Does anybody have any questions about the requisition list? Perfect, thank you.
You want? Okay, the next thing on the list is a scheduled discussion with Gallagher Benefit Services Incorporated. I'm guessing you must be Michael Haggerty. It's my powers of deductive reasoning. And Kirsten, you want to set this up? Okay.
Thanks for joining us here today. A couple weeks ago. Oh, absolutely. So we asked Mike to join us here today because a couple weeks ago, we passed a resolution to sign a contract with Gallagher for third-party consulting services and insurance broker services. Mike is joining us to have a discussion about what Gallagher does, what those services will offer, and what value that will bring to the county. And with further ado, go ahead, Mike.
All right, good morning.
Good morning.
Good. All right. Hey, thank you for the opportunity. I know there's always plenty to talk about and do, so I appreciate you carving out some time for this. Again, Mike Haggerty. Here's the deck. I didn't put it in PowerPoint. I put it in handout, kind of old fashioned. Still like to feel the paper in my hand. So here it is. And I just want to walk through some things and as Kristen said, just talk about what Gallagher is, who we are, and how the partnership with the county can really impact what's going on in your benefits program. Well, let me just, there's the agenda and the 7 things there. And by the way, I want this to be much more conversational. I want to review a few things, but I know you may have questions on some of what's been talked about. So please jump in at any time. Let me just give a little bit about myself and Gallagher and the team that would be here. So I actually live just up the lake shore in Saugatuck. So if you asked about the drive this morning, it was actually beautiful, right? The roads were fine and it was a good drive down. Just as a part of history and why it makes sense, Gallagher's an international broker, right? We're a big benefits and PC workers' comp broker across the world. I actually manage our West Michigan office, live in Saugatuck. I've been with Gallagher for 7 years, but actually the 20 years before that, I was a school CFO and head of HR. So in the Grand Rapids area. So actually the majority of my career, I've been like Kristen, I've been like others who actually, I was a client of Gallagher. So what's important about that is, you know, I'm a finance guy and an MBA guy. I'm an HR guy. So I've seen it from your side and now I see it from Gallagher as well. So when we talk about strategy, when we talk about making improvements, it's helpful to have someone that I think has been in that seat, which I have. We bring quite a team to you. There's actually 4 levels of support that we would bring to you. I would be the lead consultant. My face would look very familiar between the committee between these meetings, especially with the HR team. I would be leading this relationship. a gentleman would assist me by the name of Chris Glass. He works with me. He actually worked in education as well and joined me 3 years ago. Your day-to-day support would be a lady by the name of Melody Harris, who has a deep background in employee benefits with a number of companies. Melody would really be the day-to-day contact for questions that Kristen and team would have. And then we have one more layer of support that would kind of be behind the scenes, and her name is Maddie Dreyer. Just one more thing about kind of my experience here. I got a call probably 7 years ago from Todd Gustafson over at Connexus, and they were looking at how they could add more support for students, for kids, for training, whether it's CTE program or what they could do. If you know Todd, he's a clever guy. Before long, he had convinced us to start a charter academy called the Bridge Academy. And I was actually the board president for the first 6 years. And I just got off the board in January. Our meetings, their facilities over in Benton Harbor. So just a great program impacting youth. So just so impressed with Connexus, the job they do and how they fit into the community. What's been fun for me is to be able to take my school experience and be able to help out the Benton Harbor, Berrien County area in order to help some kids that were certainly in need of kind of a different opportunity. So very successful. I think it was 6 years, 2021 to this year that when that had started. So the next page, just real quick on Gallagher, again, big international broker. This is our expertise. This is what we do as employee benefits. Large company, 50, 60,000 employees, all of that stuff. So what's important about that is we have the bandwidth to be able to do whatever's needed, whether it's a comp study, whether it's a review of pharmacy spend, whatever your need is, maybe it's a well-being initiative, whatever it is, we have people that are able to do that. And fortunately, you also have local people who are able to lead that. So I won't go deep into that slide, but you can see who Gallagher is and certainly recognized. A Gallagher has been the CEO of this company for the 90 some years that it's been around. Take great pride in Special Olympics and a great place to work for women by Newsweek and equality. And so while corporations sometimes become corporations, the culture inside of Gallagher and who we are, I think is really special. The next page, in the consulting agreement that was approved, there is a scope of service. I'm going to do you a benefit and not read through the scope of service again, right? It's already been approved. But what I did was just want to highlight a few things. What I did was cut and paste it from the actual agreement. This is all of the expertise that Gallagher will bring to the county to help. And every bullet point is meaningful, to be honest. Everything is a task that we can do. And sometimes we get confused because we think, well, if Gallagher's going to do that, what would our HR team do? And I think the clearest way of thinking about it is we are a support for your HR team. We are the expertise. We are the industry experts, just like you use an attorney or an accountant or other people that are industry experts. This benefits is our expertise. So when you look through here and you see evaluate carrier projections, and you see coordinate carrier negotiations, large claims tracking. Just to give you an instance, when Brian and Kristen sent me your initial stuff from Blue Cross, I looked at your pharmacy agreement and I compared it to the pharmacy agreement with one of our other clients. And within a minute could tell where your rebates, where your dispensing fees were different than what this client was. And what we do then is we go back to Blue Cross, and by the way, it's a Blue Cross client. We go back to Blue Cross on your behalf and say, hey, I think there's an opportunity to improve what's being offered to the county. When we look at high-cost claimants, when we look at projections, that's all things that we can do. Gallagher fortunately is the largest client of Blue Cross, broker client of Blue Cross in the state. Just this morning, I was looking at an email I received from their president of West Michigan. So our ability to talk and negotiate, and to be honest, that's things that your local HR department is never going to have the expertise to do. You don't play in the industry. You don't know what rebate percentages are. You don't know what admin fee. You don't know about stop loss, nor should you have to, because that's why you hire a broker to do those things. So that is what we're going to bring. And, we're going to work with you to look at a strategic plan. We're actually going to help create material to educate employees as well. You have a lot of retirees. Retirees have a lot of questions, right? We're going to add that service to be able to do that. But I'll say with a lot of these, for example, the communication material, it says that we're going to assist you. If a strong HR department and a strong broker is the perfect model to have, because we're going to complement one another. If one of them is struggling, neither of them will be effective. So the need to be able to properly manage the work that's being done. We have just an array of different open enrollment education materials that we can help produce for you. But it's going to be your team that is able to take that and talk to staff. Now, we can talk to your staff, but let's be honest, people, normally employees, want to call HR and ask them a question about their benefits. They want to run into them in the building and say, hey, I was thinking about this. So when the two are in alignment, we're going to produce great material. We're going to help with your negotiations. We're going to track, I'm a finance guy. I love numbers. We're going to track your expenditures. And by the way, you run a nearly $22 million medical program. That's a large program, right? A 5% savings is $1 million. And we know with a total comp model of wages, benefits, and retirement expenses, $1 million saved someplace goes to some other place in that comp model. So that's what we're going to bring to you in expertise to be able to see where in a $22 million program where we think there's some improvements, and those savings are going to go back to the county and really back to the employees in some way as well using that model. So again, I won't go through all of this, but there is a ton of things that we will do on your behalf. And why I say that as I turn to the next page, because we're already doing it. Here are, I think, 19 counties that we're doing similar work for already. This is important because just like having worked in education, having worked with counties, you're all different in a way, and you're all the same in ways as well. With the ability for me to be able to look, and I don't want to necessarily name counties, but to be able to go to Ottawa County and work with them and see what they're doing from a strategy standpoint, taking the best of what they're doing. I've been working with Allegan County for 6-7 years. They are amazing at promoting preventive services, tracking preventive services, and making sure, because we know prevention leads to good health, so early detection is important. So for us to be able to use our relationships and our benchmarking and the expertise with 20 different groups like you and bring it to you. And by the way, in a few years, we're going to look at it and say, gosh, Berrien County is doing this better than anyone. We're going to help use that on what we're consulting with other groups as well. So from plan analysis to how much employees are paying, contribution model, to GLP strategy, drug strategy, to incentives, and even dental and vision. Hear a lot now about network and, hey, what's the max out of pocket? We get counties talking to us all the time saying, can you just tell us what others are doing? So to be able to benchmark and share and use best practice is probably one of the better things you're going to get out of this relationship, although I think that scope of service and a lot in there is going to be good. But we're going to be able to share ideas with you that we've seen work and effective in other areas. I just want to hit on two other things and then I'll open it up for questions. So we have a local team, like I talked about, us four that are going to be here. I'm sorry, I keep moving from the mic. I thought you were going to get up and kick me. So she thought about it, didn't she? We have four layers of service that will be right here for you. In addition, because of Gallagher's scope, we have a benefit advocacy center. This is a dedicated 800 number that any of your employees can call and get questions on benefits. It's that next layer of, and I think it said in here, hours are 8 in the morning till 6 at night. So some of those people that may not, be able to do it during the day, you have till 6 at night or whatever it'll be. So you can look at all the scope of service in here, and this includes retirees as well. This gives that next layer. Now, it doesn't substitute what's going to happen within your HR department. It's going to add to what's going to happen in your HR department. So to be able to get the local service, to get an advocacy center, and by the way, we have groups using this today. Groups that we talked about are using this today, and we're going to track how many phone calls are made and whether it makes sense to you and what questions they're asking. So that's all data that we're going to give back to you. And then just one last thing that I would mention, because some of you may have heard about it. 20 years ago, 8 school districts up in Kent and Ottawa County started their own health insurance pool. It's called the Western Michigan Health Insurance Pool. What started out as a school pool turned into a public sector pool. Excuse me. When I say public sector, I mean school districts, counties, cities, road commission, community mental health, community colleges. The Department of Insurance and Fiscal Services out of Lansing lets public sectors pool together to share risk. It is actually the largest now health insurance pool in Michigan, and it's the largest health insurance pool inside of Gallagher, and we're a large company. So when you look at the entire United States, their pillars are member focus, value, and trust. The people on their board are county administrators, school superintendents, city managers. Those are the people making the decisions and driving it. On the next page, what started out as 8 became 11 in 2005 is now up to 278 entities. There's 278 public entities around the state that have pooled together. They represent 27,000 employees and about 62,000 total lives when you look at dependents. I'm not suggesting the county is ready to move into this model. But I will say, and by the way, on the next page, I only took one with 278 groups. We got, I think, 3 or 4 pages that list out. I only took the kind of the West groups. So you can see up in Ottawa County, all of the different groups that are in Kent County, Allegan County, Berry, and I wanted to point out Berrien, which is kind of in the middle of the page. City of Bridgman, City of St. Joe, Coloma, Lakeshore, Niles are all already in the pool. Again, I'm not suggesting that it's time for the county to move into the pool, but what I would say to you is Gallagher manages this pool. And now that you're working with Gallagher, this is an option for you for some time down the road. I'll give you an example. Ottawa County did exactly like you are with a consulting agreement for a dozen years and then just moved into the pool the last year. There's other counties like Allegan County that moved directly into the pool from the start. So it's all over the board on what happens, but because you haven't been working with a broker before, I think it would be good for us to take some time to look at your large program, find the efficiencies, find where we can save. And then if it makes sense down the road, we know that that's always an option. But that could be a few years down the road. I think now we're just ready to dig in and get started on your program by helping employees and seeing where we can save. I got a next slide that says Q&A and then a thank you slide. So, yes.
Questions, ma'am?
How do you plan to notify the employees, or when is this going to take place, this change of notification? So there's communication.
Well, when would we notify employees that Gallagher would be there to assist?
Right, like, are you going to send something, or do we
Yeah,
plan our personnel department? How are they going to know there's a different plan in place?
yeah. I would say this, to start, there really isn't a different plan in place. Oh, the Benefit Advocacy Center. Yes, got it. Yeah, thank you. No, it would come out of your HR department. They would say, congratulations, we have another layer of service that is there to offer you assistance if you have questions on your benefits.
Well, that would be dependent. So as of right now, that would be dependent because as of right now, we have the agreement approval that we have with Gallagher is for consulting and for our insurance broker. The Benefit Advocacy Center is above and beyond that agreement. That is not included in our current agreement. And so we would need to add that on. There is a cost associated with that Benefit Advocacy Center. Fortunately, it is relatively affordable. It is $125 per employee per month, which for us will equate to just about $1,000 a month. And so that would take a significant amount of workload, but not all of the workload off of human resources. So as of right now, we've been tracking calls and we get anywhere from 10 to 20 calls per day, just asking basic benefit questions. Something like the Benefit Advocacy Center would allow us to redirect those calls if it were approved. And then we would be able to focus more on the administration of the benefits as well as supporting employees in other ways.
So let me follow up. So at this time, currently, you would be still the main contact for all the employees. They would not go directly to you.
Absolutely.
Correct.
At this time.
Unless we buy a secondary plan.
Unless we
upgrade.
sign up for the Benefit Advocacy Center.
Okay.
All of the benefit administration remains in human resources. And so that includes all of the enrollment, any changes, any questions. That includes the dental vision reimbursement. It also includes things like our work comp plans. Everything still maintains in human resources. The difference than what Gallagher brings is working with the vendors to ensure that we're getting better contracts, to negotiate those contracts, similar to those meetings that were held in December. So we went back and met with them and really talked down some of those contracts and did those deep dive reviews. It's having that expertise, somebody that can compare our contracts with other contracts, which a benefit manager will never be able to see the contracts from every other county or from 20 other counties, as well as contracts from dozens of community colleges and cities. We will never have that access. We won't know how those two things line up and how those parallel. And so we cannot leverage those savings. The second thing that the consultant will do is bring us expertise to advise on day-to-day operations or questions or issues that arise. So the consultant then would be someone that we could contact when we have a question for serious claim issues. They have a claim advocate that would be assigned to us. So if we had a claim that needed to be resolved that was not being handled properly, they would assist in doing that specific work. But the day-to-day operations with Gallagher as structured maintains relatively the same.
Yes, sir.
So if they do the review and they find places that there can be savings, do you then go and negotiate with our provider, or does that stay in-house as well then?
I would call it in tandem. The provider will want the the client and the broker there. What we're gonna bring is the expertise analysis of it and probably make a few phone calls behind the scenes to say, hey, we know we can, what we're doing. We talk to them quite a bit, so we're gonna have that flow. But you really want your HR to be the leader in that as well. I would just say, in the other groups that we've worked with, which is a lot, the work of Gallagher, I'll say, supplements what they're already doing. It doesn't replace what they're doing. They still have a big workload. It's just having someone else to help put it together.
Anything else? Yes, ma'am.
Just a point of clarity. So for the fall benefit center, you said 125, is that $1.25?
Yeah.
Okay, and so with the average calls being between 10 to 20 a day, you're calculating and thinking that ultimately it's $1.25 per person, irregardless if they call, or?
Correct,
Thank
correct.
you.
Yeah.
I'm just trying to understand if
Yeah.
it's based on call volume or if it was
No,
based on the number.
it's based on
Yeah.
head count.
Okay,
We
yeah.
need the people available to be able to answer the calls no matter how many
Absolutely.
call.
Okay, I appreciate just trying to put my head around the
Yeah.
numbers. Thank you.
Yes, sir.
It sounds to me like in a practical application for every day, if our employee needs something and has to call, they call HR. If they need, say, a letter or an insurance card or anything else, they still do HR. Gallagher has nothing to do with that.
That's absolutely correct. They would
Okay.
still continue to contact us for any of their needs if they, I mean, you can order insurance cards on your own going through the Blue Cross portal, but I will say many employees do reach out to us and request that we do those types of things. And if you have questions, if you have a change, if you have a baby or get married or those types of situations, you would still contact HR and HR would still process those changes.
Okay, so are there any plans to add someone to HR to still handle that?
Yeah.
Because
They
Gallagher
don't
isn't
need-
handling that. Are you gonna have to hire somebody to take care of that?
Well, we still have the budgeted benefit manager position. And so my understanding has always been that we were going to continue hiring and backfilling that position. That position is absolutely necessary for the.
Wasn't sure.
Okay, that's true?
We're talking about it.
Okay.
One of the other things we were talking about is how much can we do with Gallagher that would impact taking on another full-time equivalent employee or even a part-time. And that's, I think, why we've done this today. And when we were informed about Gallagher, one of the things that was mentioned by Brian was they can handle the calls. And handling the calls would be a big plus because right now you've got Annette and Kristen and Wendy and Betsy taking calls. But there very well might still be a need for another person, whether it's handling comp, whether it's other things related to benefits, to helping with personnel and human services matters. But if we can shift calls over, that also relieves the call burden on people who are up there in admin right now. And so that's one of the things we discussed in committee last week, and that's why I think Bob wanted to have Gallagher come in. Yes, just one second. Ashok, and then you.
Yeah, I'll add to that. Part of the discussion also last week was to have a fill for the gap, right? And even if we fill the position, it's gonna take weeks. You know, it's not gonna happen overnight. So we need somebody to be able to help with those calls just to fill that gap.
Okay, and then Shokwe.
It's all good. Go ahead.
Jim.
Just a quick follow-up. Right now, they do not provide that service.
No.
What you're saying is that's an additional service at $1.25 per employee,
Per month,
$1,000 a month.
about $1,000 a month.
just to handle phone calls. But then, okay, if the phone call says, I need an insurance card, then it comes back to HR. They gotta prepare that paperwork and get it out, correct?
I don't think so.
Yeah, typically, if even HR gets a call about needing an insurance card, we ought to redirect them back to the app and the carrier to get it. So I think the Benefit Advocacy Center can do that. But you're right, most of what the Benefit Advocacy Center is going to do is say, answer coverage questions. A number of those questions would typically maybe go to the carrier or someone else. And I would say 90% of the calls are going to happen during open enrollment, to be honest with you. That's typically where the majority of the what plans should I select, how does this impact me, will come up.
You agree?
So, I don't know enough about the call volume during open enrollment to be able to answer that question directly. My past experience with other employers would definitely be yes, that having discussions about enrollment during the open enrollment period is a higher volume. Also, if you make any changes to the plan as that goes into place. What I can say is of the about dozen calls we had yesterday, several of them were, as he's describing, coverage based. So it's calls that we get that say things like, I don't understand my invoice. Is this even correct? What is a deductible? They're pretty straightforward calls and you need to understand what the plan says to give that information back. It's not always action-based calls of, I need an insurance card.
Joe Quay.
So I guess the only question I had was around the Benefit Advocacy Center. Is the ask today for it to go to committee and then come back to the board, or are we, because from what I've heard, that is not a part of the current plan, but that seems to be the thing that would alleviate the most stress off of the HR department.
So my understanding is that we can't make any type of decisions in these meetings. This was intended to be an informational presentation, just that way there's a better understanding of what Gallagher is bringing to the table. If you would like the ask, then yes, absolutely. I do think the Benefit Advocacy Center, at least on a short-term period of time, would be a great option for us, especially while we are short-handed without the benefit manager to reassess and redirect those calls. Not only would we allow us to redirect the calls and relieve the stress from human resources, but it would allow the employees and the retirees to get more prompt answers than what they're getting right now. And they deserve those answers. They deserve to have answers to their questions. And so this would be something that even if we did it for the next 6 months, while we're evaluating and backfilling and looking at what are the staffing needs in human resources, that could be something that would help.
Mike and then Terry.
Is there a minimum time period for that add-on?
It'll take us a few weeks to get it up. Oh, you mean to cancel it?
Yes.
I don't believe so. I believe you can cancel it at any time, maybe 30 days notice. Yeah.
That was a great question. That was partly what I was going to ask. And then my other question for you, Kristen, is just with regards to the call volume. I do know we had a special open enrollment because of the changes in what we had benefit wise. So with this call volume, can you give me an idea of how many of those 10 to 20 calls a day might have been regarding open enrollment? Just to understand.
The special open enrollment period ended in January.
Okay.
So the calls that we've been seeing post that time have not been related to that. The calls that I've had over the last week or so, it's
Has
still that 10 to 12. That period of time, I would have said, I did not count those, but it was higher.
Okay.
I was getting many emails as well as many calls per day. And we were intentionally directing people to emails so we could manage those throughout the day.
Thank you. Appreciate that.
Yes, yes, sir.
Interesting point on emails. Does the Benefit Advocacy Center, could they forward emails, or is there an email box that people could, if they didn't have a phone or they didn't have access to a phone, to be able to communicate that way?
Yeah, I believe it's a phone and email.
Thank you.
Any other questions? I've asked Alex to join PHS this morning since Bob's gone. Would PHS be willing to entertain action on bringing in the call center, which we could then review next week if the board's inclined, and then approve it? If that happens, How long would it take you to go live?
Let me get back to you. I think it's gonna be a few weeks to share the data, to get them set up, but, I'll tell you this, we would expedite it as quick as we can, understanding the need.
Okay. Ma'am,
Can you guys come to PHS today?
Pardon me?
Can you guys come to the PHS meeting today?
Sure. What time is it?
In 5 minutes.
5 minutes.
Sure. Absolutely.
Immediately following this.
Can you follow us upstairs?
Right, any other questions? Okay, so if PHS would do that, unless there's some objection to moving forward with supplementing the plan, if PHS would do that, we could be looking ahead next week to moving it, doing a resolution or approving a resolution. Well, if you don't mind. Okay, all right, anything else, anyone, any public comments? Okay, hearing none, we're adjourned to 10:30. I'm gonna have to cut out for a doctor's appointment, but I'll follow up with Thaddeus on the closed session.